Hello, everyone. It's Tuesday, March the 30th. I'm Carla Kath. I'm the Communications Director at MCB. Welcome to our first town hall for the deaf-blind community. We are so thankful that all of you could join us today. Opportunity to come together. We have on-screen certified deaf interpreter services, as well as CART, real-time captioning services for this meeting. We ask if you're not presenting to please turn off your video. We will spotlight our CDI and our presenters so that they are enlarged on the screen with so many of us here today. And if you wish to enlarge and center another participant's video, you can do that on your screen by selecting Pen Video in the context menu, which are the three dots available in the top right of a video thumbnail. And to access CART real-time captioning services on your screen, please use the Zoom chat. It's in the chat. The stream text link is available. And if you need that link directly at any time, or if you have any other questions, there are 3 MCB Zoom hosts available to help you today. Please send any of us a chat during the meeting and we will assist as much as possible. There is myself, MCB Zoom host 1, Carla Kath, my colleague, MCB Zoom host 2, Samantha Linden, and my other colleague, MCB Zoom host 3, Camilla Dragos. Please reserve your questions for the discussion portion of our meeting at 12:15, where we will ask for all questions to be entered via chat. If you do have questions, however, during the presentations, please enter them in the chat at that time, and we will reserve them until the discussion portion of the meeting. And with that, we will get started. We have our first presenter with us today for the town hall. That is MCB Commissioner David D'Arcangelo. Commissioner, thank you for joining us.
Good morning. Welcome. Welcome to this first virtual town hall for our deaf-blind community. We hope to make this an annual event. Thank you so much for joining. The Massachusetts Commission for the Blind is so pleased to collaborate with our partners at the Massachusetts Commission for the Deaf and Hard of Hearing, Deaf Inc., and many other organizations and professionals who help us serve our shared community. We are committed partners working together to ensure that individuals who are deaf-blind are represented and served with accessible programs and services. I am so pleased to welcome the new commissioner for the Massachusetts Commission for the Deaf and Hard of Hearing, Dr. Ope. Good morning, Dr. Ope. We recognize the challenges to meeting virtually during these challenging times of the ongoing COVID-19 pandemic. In the future, when it is safe to do so, we look forward to meeting again, which will give us more opportunity for in-person interpreter access. For those unable to join us today, or anybody who would like to view the recording of this town hall will be made available to share after. MCB has primary responsibility for delivering services to the deaf-blind community in Massachusetts, and our director, Leslie Baker Johnson, is here today to tell you a little bit more about that after I speak. Leslie is the director for our deaf-blind Extended Supports program, and her team do a great job. Our agency's deaf-blind unit counselors provide consistent and direct outreach to individuals and their families who are deaf-blind and blind with developmental delays. We assist with community access, communication accessibility, vocational training, case management, and advocacy. We are there to serve you. MCB provides ongoing funding for the Deaf-Blind Community Access Network, or DBCAN, as well as our relationship with the Helen Keller National Center to provide social rehabilitation services, technology, training, independent living skills, and Braille training for individuals who are deaf-blind. Recently, MCB implemented new vocational rehabilitation services, working with the Helen Keller National Center, specifically programmed for deaf-blind consumers who are seeking to re-enter the workforce. Additionally, the Massachusetts Commission for the Deaf and Hard of Hearing works with our agency to provide guidance for access to print and online materials for agencies and community partners. We recognize the challenges presented by COVID-19. And thanks to the resilience of you all, our community, our agency partners, and the whole deaf-blind community, we have continued to deliver our services across the Commonwealth. Examples of some of our activities include, since March, our agency has enhanced outreach to the community through a series of virtual events, including 4 stakeholder meetings, which included approximately 65 participants, and a presentation from Sharon Applegate of Deaf Inc. in March. We had 4 virtual town hall events to reach individuals who are blind, visually impaired, and deafblind. And we were so pleased to have our first virtual open house back in December, where we showcased increased accessibility for individuals who are deafblind, and a presentation by Elaine Ducharme of Deaf Inc. Thank you, Elaine. MCB has proactively worked to raise awareness of services for the deaf-blind community. This includes a media interview with WGBY Connecting Point to discuss the MCB services for our deaf-blind community in Western Mass during COVID-19. I participated in a live panel event with the producer of Feeling Through Live to support the first actor who is deaf-blind in a leading role. We also featured a success story of an individual who is deaf-blind and his caregiver on our social media channel. Please check out our website, mass.gov/MCB, and look for the news section. MCB continues to educate our staff to the community's needs. This includes hosting Carrie Thompson, a prominent figure in the deaf-blind community, who spoke at our annual MCB staff meeting in September. She spoke to resilience and the importance of services for individuals who are deaf-blind. Our colleagues at the Massachusetts Commission for the Deaf and Hard of Hearing and case managers collaborate with MCB on the provision of case management, communication access, and advocacy of services as needed. We are so pleased of what we have been able to accomplish during the pandemic and over these past few years. However, we still know that challenges exist and present us with new opportunities to learn even further while we adapt and grow together. MCB and our colleagues continue to work together to deliver on our shared mission to ensure access to programs and services for individuals with disabilities. We want to make sure that everybody has access and opportunity. We are there to serve you. Please let us know how we can do that. And now, to learn more about our MCB Dbes unit, I am so pleased to introduce our director, Leslie Baker Johnson. I want to thank everybody for being here today. Leslie, over to you.
Hi, everyone. This is Leslie Baker Johnson. I'm the director of the Deafblind Extended Supports Unit. We are so excited to share with you about our unit and services, as well as welcome all of our partners who are here today to present. I'm so glad so many of you were able to join us today. Just to start, I want to explain our registration process. So in order to receive services from MCB or from the Deafblind Extended Supports Unit, the individual would need to be registered with our agency as legally blind. And that involves registration from an ophthalmologist or optometrist. And the process then goes to our central registry department. And then depending on what is written on an I-report, the individual is assigned to a region or department, such as the Deafblind Extended Supports Unit. Individuals whose I-report says that they are deafblind and communicate primarily through American Sign Language are automatically referred to my department. And individuals who are identified as having a developmental disability and registered with the Department of Developmental Services are also automatically referred to my department. Any individual who's registered with the Commission for the Blind has access to our general services. That includes case management, information and referral, vocational and pre-vocational programs, orientation and mobility services, rehabilitation teaching, adaptive technology and low vision aids, certificates of blindness, MCB IDs, as well as assistance with handicap placards. Those are services that any individual who's registered with the Commission for the Blind has access to. Consumers who are registered with the Deafblind Extended Supports Unit, that I call DBES, we all call DBES, so I'll just abbreviate, make it easier for the interpreter. Services in my department can include residential supports. Those are primarily provided to individuals who are turning 22 and leaving the school system and moving into adult services. They would also be requiring 24/7 residential care. Many of our clients who need that type of service have other significant disabilities besides deafblindness, including intellectual developmental delays and also medical fragility. We also provide respite supports, flexible funding, and assist with transition services from school to living in the community. That process involves a lot of coordination with other state agencies, and in our case, specifically DDS, which we all work very collaboratively with all of the area offices to make sure each individual is getting the services that they need. MCB and the Dbes unit contract and provide funding to various community providers for deafblind consumer services and programs. These programs include the Deafblind Community Access Network, or DBCAN. This program allows many deafblind adults access to their community and social opportunities and is administered by Deaf Inc. There's also the Deafblind Contact Center, which provides social and recreational events in the community for our deafblind consumers. We also work in collaboration with the Helen Keller National Center, who provides services, supports, and training for consumers interested in learning deafblind specific independent living, technology, communication, and Braille skills to enable them to be as independent as possible. We also provide referral services to a program called I Can Connect, which is an FCC funded program that provides equipment and training related to distance communication for individuals with combined hearing and vision loss who meet federal disability and income guidelines. You'll hear more about all of these programs in the presentations to come. We were lucky and thankful enough to have individuals from each one of these represented today, can give you more information. The MCB DBES unit's goal is to enhance consumers' independence and the overall quality of life. The DBS unit itself is comprised of a valuable team who each bring specific skills and knowledge to the unit. Each case manager, we have 6 of them, have approximately 100 open and active cases at any given time. There's myself, Leslie Baker Johnson. I do not have a caseload, but I am available to support all of the counselors in making sure that the services are available and provided. Region 1 is Western Mass, and Mary Kate Logren is the case manager providing services in that area. Region 2 is Central Mass, Worcester, North and South, and the case manager for that region is Peggy Farin. Region 3 is our Northeastern region, and the case manager for that region is Stephanie Matuccio, Mattuccio. Case manager for Region 4 is Metro West South Shore, and that's Christine Dwyer. And we have our Southeastern Mass, Cape and the Islands case manager for Region 5 is Jean Hoy. And we have our case manager for Region 6, which includes Metro Boston, Revere, and I believe Chelsea, is Ann Cantrill. Ann Cantrill and Mary Kate Logren, in addition to providing our social rehab services, are our 2 qualified vocational rehab counselors. So when we have consumers that are interested in vocational rehab, their case would be assigned to either Mary Kate or Ann, depending on where they live geographically. Mary Kate provides VR services to consumers who live Worcester and the western part of the state. And Anne provides vocational rehab services to individuals who live from Worcester all the way to the east, Cape, and the islands. So they have a lot more responsibilities in addition to their social rehab caseloads. They also, the VR services for our department are intended for individuals who are deafblind. And that would be individuals requiring ASL or communication access resources that our department specifically has for VR. All of our contact information is available on the DBES unit vlog, which can be located on the MCB website. And in that lists each counselor's name, email, and cell phone number. If you have any questions for any of us, please put them in the chat. We'd be happy to answer them at the end. And I am going to turn this over to our partners at the Mass Commission for the Deaf and Hard of Hearing. We have Aurora Wilbur, who will begin those introductions. Thank you all very much. Aurora, I'll let you take it away.
Leslie, thank you so much, and thanks to everyone who's joining us today. We're all very excited to be here. I'm going to start with letting our new commissioner introduce himself to all of you, and then you'll have a chance to meet our case managers. Deputy Commissioner Patricia Ford is with us today, and so are our independent living services providers. And so we will do quick introductions to everyone.
Interpreter speaking. Sorry to interrupt. Can we just hold? We want to go ahead and switch the interpreters out.
Of course.
And then, or do you mind starting from the beginning? We missed the first 30 seconds.
Sure. I wanted to thank everyone for being here today.
Oh, wait 1 moment.
Great. Thank you.
We're good? All right, I'm going to turn it over to our new commissioner, and then you'll have a chance to meet our case managers and other staff. Introduce you to Dr.
Hello and good morning, everyone. It's an honor for me to be with you today. And it's really very exciting to work with Commissioner D'Arcangelo. Since I arrived here, the two of us have been in discussion of different areas, and I'm very impressed with what MCB has been doing, especially related to the deafblind community. A little bit about my background. I recently moved from Missouri, and in Missouri, I served as the executive director of the Missouri Commission for the Deaf and Hard of Hearing. In my role prior to being hired, people who interviewed for that position, one member of the board was deafblind himself, and he asked me what my plans were for deafblind people, and I was very surprised because I had no idea about what it meant to be deafblind. My only experience was that I saw deafblind people at Gallaudet using tactile communication. And then after that, no experience or exposure. And I responded that I was willing to sit down and learn about his issues in order to resolve them. The two of us worked, and the first bill that was passed in Missouri was to establish a statewide SSP support service provider program for independent living and for the deafblind community in Missouri. So that was my first bill, and I was very proud that I could make that happen. After that, I wrote more than 22 other bills, but none gave me the joy and satisfaction that that first bill to establish the SSP program in Missouri gave me. So it still is run under the Missouri Commission for the Deaf and Hard of Hearing and getting state funding. So it's really different. Our roles are very different. MCB and MCDHH, we are here to support the community in as many ways as we can. And I realize that the communication and accessibility needs are so diverse, especially that we have different experiences and different collaborations. So we are going to be working completely in partnership. And I look forward to working with you all, especially after COVID. I hope to be able to communicate with you one-on-one. And I hope to more listen to the areas that we can work together on. And I'm sure that you can have faith that we as a community coming together can achieve anything we want. So I would like to now turn this over to our case manager, the interim director, Carol Menten. She will introduce some of her case management staff and explain the roles that they have in this office. Carol?
Okay, yep. Thank you, Commissioner, and good morning, everyone. I think we're gonna have to switch out interpreters, is that right?
No.
Are we good? Are you good? Okay, awesome. Okay, great. Okay, good morning, everyone, and thank you and welcome, Commissioner Opay. We're excited to have you with us. And I want to just say that, you know, I am the interim director of case management. I will make sure everyone has my email address. I will not be speaking as long as Leslie, but I do want to recognize our staff. And we have on this call, we have 7 staff, and I want to just, I don't know if this is going to work, but I'd like to have them just appear very quickly when I name them, if it's possible. So we have, this is alphabetical order by last name. So we have Melissa Adams, who is our children's specialist for the Southeast, Cape Cod, and the islands. Good morning, Melissa. Next, again, alphabetical order, is our children's specialist for the Northeast, Boston, Metro Boston, Melissa Dowler. There she is. Good morning. And then we have Allison Fondal, and she is our adult services coordinator for Southeast, Cape Cod, and the islands. Good morning. And then we have Sharon Harrison, who is our adult services case manager for Boston Metro. And she will pop on another time. And we have, finally, we have the children's specialist for Western Mass and the Berkshires, and that is Emily Graves Harrison. Good morning, Emily. And that's who we are. We're small, but extremely capable and competent and creative group. And it's a pleasure to work with them. So I'm going to turn it over. That said, I'm going to turn it over to our Deputy Commissioner for Programs, and that is, and my immediate supervisor, and that is Patricia Ford. Good morning.
Good morning, everyone. It's a pleasure to be here. I miss my third floor colleagues, seeing you in person. I'm the Deputy Commissioner of Program and Policy, so I do oversee the Case Management Department, the Interpreter Department, our Independent Living programs, and our training program. So I'm proud in terms of our relationship with MCB over the years. We have provided an intensive training for deaf-blind interpreters. Over the years, we are once again going to provide a mini workshop for review in collaboration with MCB, presented by Elaine Ducharme again, to encourage more individuals to be interpreting in the field. And we also collaborate working with the Commission for the Blind in providing access for our deaf-blind constituents, which again, as Commissioner D'Arcangelo mentioned, has been a real challenge during COVID. Again, this is an exciting event, and I'm pleased to be here and look forward to hearing more input from the community on what the needs are. So thank you.
Thank you for that, Tricia. Would you just call out our other staff who are able to be with us today, please?
Thank you, Aurora. I'm looking, as there's so many people on the list. Sorry, I believe Karen Eddy is with us today, who's our HR liaison. Oh, she popped up. We also have Karen Larson here with us today, who is our statewide coordinator for substance use disorder and deaf recovery coaching. Karen can pop on. And also we are looking, hopefully, to provide another training for recovery coaching. And include a deaf-blind constituent. We also have with us today Diane Kraus, who was hired to support me when I was in the role of acting commissioner. I oversee a number of programs. Diane was a former children's specialist with the agency, and she had worked with our victim service program. We hired her back to oversee our training department and our oversight for our victim service program, which is being led by Shannon Silvestri, and to oversee our substance abuse program. So Diane is with us here today. I'm hoping that I've caught everybody, Aurora, who's on board. Thank you again.
Thank you so much, Tricia. This is Aurora speaking again. In addition to the services and supports that Tricia mentioned, we're also very proud to partner with really all of Health and Human Services, representing all of our needs. And I'd also like to recognize the significant expertise and resources that our independent living services partners provide. So I'm wondering if Sharon or Carol from Deaf Inc. can introduce the staff that are in attendance today. Thank you, Sharon.
Sharon saying, I'm Sharon Applegate, and I wanted to talk about the program. I'm next on the agenda. Say it again. I'll be after the break. So I wanted to bring on Carla again to talk about the agenda.
Thank you, Sharon. This is Carla Kath from MCB, and we will get back to your presentation in just a few minutes. We did have a very exciting guest with us today, and he is actually joining us from a movie lot in California. His name is Doug Roland. He is the director for the live action short film, Feeling Through, which features the first actor who is deafblind in a leading role. And Doug just let me know that he's having some connectivity issues from that movie set. So we will give him a few minutes to join, but I let him know that we were going to share the video clip that he passed along from that film right now, with the hope that he'd be able to join in a few minutes. I believe we are going to have an interpreter switch quickly, and then we will begin that first video clip. Right. All right, I am going to share my screen and show you this first clip from the film Feeling Through. And this first clip shows the interaction between the actor who is deafblind and also the individual who he meets on a street corner at night. It's very dark out, very quiet. And kind of the whole film itself involves this street corner and a bench beside a bus stop. So that kind of sets the scene for you, and hopefully Doug will be able to join and tell you more. Let's get started.
So the interpreters will be interpreting, and you can watch the film.
Correct.
And choose not to watch the certified deaf interpreter, but the deaf interpreters will be available throughout.
All right, let's get started here.
Right now, there's no dialogue.
Okay. It's close. You just.
The one man is asking for the bus route that he needs. The other man is helping him, helping the deafblind man, excuse me, with his backpack and leading him towards the bus. They're near the bus stop. The hearing sighted man is looking around on the street, wondering whether he can leave the deafblind man there. And the deafblind man puts his arm out to be guided. The other man is a little surprised because he's not used to guiding deafblind people. But he puts his hand on his shoulder and starts to guide him. And they walk further down the street.
Right. This is Carla again from MCB. Thank you very much for describing that first video clip for us from Feeling Through. I believe that when Doug shared that clip, he did so with the intention that we could show the interaction and that first meeting between the two characters as a representation of what it might be like for an individual to meet someone who is deafblind for the first time, and that initial hesitancy in how to communicate. So hopefully Doug will be able to join us soon from the movie set. If he is, I know we have a couple of questions in the chat, and we will share those with him so that he can provide feedback with all of you. But we did want to let you know that that film has been nominated for an Oscar, and we are all cheering for Doug and his team at Helen Keller National Center for that award, which we will find out the results on April the 25th. And right now we have a short break. We are actually running a few minutes early. So please submit your questions in the chat. We will collect them during the break, and we will address them at 12:15 when we have more time to ask questions of our presenters, all of them with us. And we will take a 10-minute break. We will come back shortly before 11 o'clock and get started again with Sharon Applegate from Deaf Inc. So please come back in 10 minutes at 10:55, and we will get started right at 11 o'clock. Thank you all again for joining. We'll take a 10-minute break. If you need anything during that time, please send a chat to myself, MCB Zoom Host 1, Carla Caff, MCB Zoom Host 2, Samantha Linden, or MCB Zoom Host 3, Camilla Dragos. All right, thank you. Be on break. Hi, everyone. This is Carla Kath, Communications Director from MCB. Thank you for joining us for another part of our town hall for the deafblind community today. MCB is grateful to be here with our partners at MCDHH, as well as with many of our community partners. And if you were with us before the break, you were able to see a clip that we showed from the film Feeling Through. And I believe that right now, the director from the film has been able to join us from the lot. His name is Doug Roland. And Doug, if you are with us, if you could just, I know you wanted to say a few words, just unmute and share your video. That would be great. And Sharon, we'll get right back to you in just a minute as soon as Doug is able to say a few words. Thank you for being able to join us, Doug.
Thanks for having me. Hello, everyone. My name is Doug Roland. I'm a white male in my mid-30s. I'm wearing some round glasses today with a little scruff on my face and dark brown hair and a green button-up shirt with a clean white background. And it's an honor to be joining you all today. Thank you, Carla, for the lovely introduction. And as she mentioned, I'm here to show a couple clips today and kind of speak on those. But just to set things up for just a moment for people who might not be familiar with me, I'm the creator of a film called Feeling Through. It was a film that stars a deafblind actor named Robert Tarango. And which is a film first. It's the first time that a deafblind actor is starring in a film. And I've had a 3+ year journey in making this film and making it alongside the deafblind community. And prior to that experience, I'd only had one encounter with a person who's deafblind 10 years ago that inspired this film. So really the last 3+ years have been this beautiful introduction and connection to, and now deep relationship with, a community in the deafblind community that I had previously known very little about. And the film in certain ways kind of emulates elements of the journey, in that our central character, one of the two central characters, Tariq, who's our sighted and hearing character, is in this film meeting a person who's deafblind for the first time in the character of Artie. And it's on Tariq's end of the journey. They each have their own, but Tariq's is a little bit of learning how to ultimately open up to another person, but part of that is learning how to communicate with and feel comfortable around, and ultimately feel like he's formed a really close bond and friendship with this man who is deafblind. So I wanted to show that first clip first, because that's the scene of Tariq and Artie first meeting each other. And it's awkward, and Tariq is nervous and a little bit maybe even frightened, doesn't really know what to do, doesn't really know what's appropriate in approaching this man, Artie. And it's altogether a bit awkward. And the reason I wanted to show that first is because something that I've learned as someone who, again, 3 years ago knew very little about the community and now considers a lot of people in the community close friends and colleagues, and also have had the opportunity to use the film and a supporting documentary to create fully accessible screening events to introduce a lot of other people to the community that maybe had prior had no connection point or knowledge of it, is both learning through my own experience and watching others kind of how someone comes to connect with and understand a community that's different from their own that they know little about. And I think one of the things that I've, again, talking with, you know, many hundreds of people about the community in the film, I think something that's really necessary in my experience that I've learned is to really accept and have a healthy understanding for those initial steps that are awkward, sometimes rife with misconceptions and erroneous assumptions. But I think also what's important to understand is, and this is obviously easier for me to say, but it's an observation that comes from also communicating with a lot of people in the deafblind community, is that if one is able to really kind of accept that that's kind of a natural part of the early goings often, it can really lead to beautiful connections on the other side. And I think ultimately what we try to do with Feeling Through and the conversations that we cultivate around it is to allow for a really open, honest space where people can ask maybe people who are coming to learn about the deafblind community for the first time can ask questions directly to people from the community and really start to very quickly dispel, learn accurate information directly from people from the community and really quickly start to rid themselves of erroneous assumptions that they may have, or really just start to fill in just questions that they have of genuine curiosity. And we found that like allowing for and really almost in a way expecting a bit of perhaps awkwardness or trepidation or lack of understanding initially, if it's obviously with at least a degree of respect for other people, can really lead to beautiful things, which we'll get into on the when I show another clip later. But again, I thought it was really important to just show that first clip because it's just an important part of the process. It's important to have a regard for the reality of what's likely to happen. I'm sure there's a lot of people on this Zoom today who know much more intimately than myself.
Hopefully they've told.
And can relate to that. And so when we get to that second clip later, I'll go more into the evolution of what we've noticed during our screenings and our events and how people have reached out and communicated to us after experiencing the film and learning more about the community. So we'll get to that in part 2, but it's a pleasure to join everyone today. Thank you.
This is Leslie. Thank you so much, Doug. Carla did air the clip, and every time I watch it, it's so powerful. We really appreciate you being here, and tons of good luck for the Oscar nomination. And can't wait to see the next clip, which will be coming up a little later. So we will go into our presentations now from our MCB partners. And first up, we have the wonderful Sharon Applegate from Deaf Inc. She's the executive director of Deaf Inc. And she will be sharing a bit about her organization and programs. And thank you so much, Sharon. Take it away.
Hi, everyone. I'm Sharon Applegate. I'm a white woman, and my hair is showing a little gray. I have a dark shirt. I have glasses. I'm middle-aged, and I have a solid background. To see that clip of Feeling Through just now, so touching to see how a hearing sighted person would meet with a deaf blind person for the first time. I'm looking forward to seeing the rest of the movie and the discussion following. I wanted to give a very short description of Deaf Incorporated, We've been around since 1977, and we provide services to deaf people, deafblind, late deafened people, hard of hearing people all through Massachusetts. Our headquarters are in Boston, but we also have 4 satellite offices throughout Massachusetts. We have 25 staff people. We also have 90% of whom of the staff are deaf or deafblind themselves. We have 3 core programs: Deaf Blind Community Access, DBCAN. That program empowers deafblind adults statewide to maintain and increase their independence by training sighted people who we then match with the deafblind adults to provide qualified DBCAN services. We have Elaine Ducharme here. She's the program director, and she will explain more about DBCAN after I finish. Another core program at Deaf Incorporated is the Deaf and Hard of Hearing Independent Living Program. We provide support and training and for deaf adults, senior citizens, to receive skills, information, services, information and referral about independent living. We have independent living in 4 different areas: senior services, information access, assistive technology, and ongoing safety in their home communities so that they can stay in their homes as long as possible. We have deaf recovery. We have support services. We have a medical case manager and health educator and advocates to allow people to have access to information about healthcare. Third, we have the assistant equipment. I'm just changing the axis here. We have federal funding where we get assistive technology training for deaf and hard of hearing consumers who have hearing aids and can use volume devices on their phone and other kinds of assistive technology, such as vibrating alarm clocks, baby crier signaling devices. Our 4th independent living is to provide deaf parenting support services. For parents, we have a group that meets and shares effective ways to deal with certain issues that affect parents, like raising a deaf or hearing coda child. The range could be from birth to teenage years. And we also give individual support to the parents. Finally, of the 3 core programs that I mentioned, we have an American Sign Language program. We offer language and culture classes for people who are hard of hearing, late deafened, and hearing adults and youth. We also offer social events in ASL for the students to interact with the community members. We also have ASL for business and providers of other kinds of support services. So thank you for allowing us to share information about Deaf Incorporated, what we offer, and you're free to ask me any questions at the end of today's agenda. Thank you.
Thank you, Sharon. This is Leslie again. Thank you so much, Sharon. You guys have such a great program over there, and we really appreciate partnering with you. I'm going to now introduce Elaine Ducharme. She is the director now for the DB program. Correct me if I'm wrong, Elaine. I think that is what your title is now. And Elaine will discuss the DB program and some of the specifics around provider role and other services that the program provides. Go ahead, Elaine.
Elaine is saying, hi, everyone. I'm Elaine Ducharme. I'm deafblind. I'm wearing a purple shirt and a red bandana as a face mask. I'm inside a building right now with my two interpreters who are doing tactile interpreting. I've worked at DBCAN for quite a while. It's the Deafblind Community Access Network since 2001 when it was established. It's housed in the Deaf Incorporated building in Boston. We provide training for professionals, in-depth training and education about working with deafblind individuals, how to empower people to gain access, that what they need. And that includes payment as well. We also have trainings for DBCAN providers, which is separate than SSPs. We label them differently because the function is different. We recruit from the community and train people to become providers. And they provide services which then are qualified at a certain level. And we pay them for their work with the deafblind community. We also work with the deafblind consumers. If a deafblind consumer wants to join DBCAN and get our services, they contact the MCB, the Mass Commission for the Blind first, the DBES, and then we get referred. There's a referral form that's filled out. Then I would meet individually with that deafblind consumer, and I would talk to them about how you use our services, the providers, as a consumer. Every month, the providers who provide 16 hours of services, but you can also sign on for 8 hours. And then we allow the deafblind person to empower themselves and decide if they want to go out with the provider to get healthy food, to go to a restaurant, wherever they want to go using those services. The provider is not an interpreter. They accompany the deafblind person to a doctor's office, but an interpreter would need to be provided at the doctor's office. They could go to a pharmacy and pick up medication. They could go to the gym. They could go out for a walk. They could visit someone in a hospital. The deafblind person makes the decision how they're going to schedule those 16 to 24 hours, depending on what the needs are every month. The provider does not do cooking or cleaning for the deafblind person, but the deafblind person makes the decision on how they use that provider. So thank you for having me be part of this program. Thank you.
Thank you again, Elaine. And I think we're going to go on now. Do we need to do an interpreter switch, or are you guys good?
Yes, we're going to be switching. Give us one moment, please. So Beth is indicating that her, there's some technical issues. She's not allowed. Yep, never mind, all set. Thank you.
Okay, so I'm going to now introduce Jason Wells, who is the Executive Director of the Deafblind Contact Center. And he will introduce his organization and what they do, some events that they've got planned and some things that have happened in the past. But Jason, I'll let you take it away.
Hello, this is Jason Wells. I'm sorry the background is so bad, but I'm the executive director for the Deafblind Contact Center, DBCC. And it is for monthly events for deafblind adults to keep them busy, have fun, instead of just staying home isolated. And we like to go out and be active a couple of times a month. We have game day, we have Halloween parties, various holiday parties. We go shopping. We go to water parks. We have Valentine's parties, St. Patrick's Day events, luncheons, a whole variety of things. And it's good for deafblind people to get together to make new friends, see old friends, catch up on the news, and much better than staying home and not doing anything. We were established in 1980 by four groups, and we've expanded to now we're housed in Deaf Incorporated. We're not really associated with Deaf Incorporated, but we get our funding from MCB, and the office is housed in at Deaf Incorporated, and we pay rent for our office. So there's DBCAN and DBCC, as well as other entities that are housed at Deaf Incorporated. Sometimes we have camping on Cape Cod. We have a retreat in Cape Cod. However, COVID came along and spoiled our opportunity for that. We had a 40-year anniversary, and then we had to suspend that. And our monthly meetings we had to suspend because of COVID. We do have volunteer support service providers, SSPs. DBCAN has their providers, but we have SSPs who are volunteers who come and work with us at our events. Some of them are college students who are learning American Sign Language and learning about deafblind culture, and they want to volunteer and support us in our activities. So that's what Deafblind Contact Center is. Thank you very much for letting me participate.
Thank you, Jason. I know it sounds like COVID has really put a damper on everything, but especially your program, since it was so focused on community activities and events with all the closures. I know you guys weren't able to do much of that this year. Hopefully 2021 will be better. I'm now going to introduce Tara Brown Ogilvie and her colleague Christine Telford. They are from the Helen Keller National Center. They're going to talk a bit about their organization, programs, and also how they're dealing with everything during COVID. So Tara, I'll turn it over to you first.
Hello, everyone. This is Tara Brown Ogilvie. Very excited to be here today to talk about Helen Keller National Center. And our partnership with Mcb and other community partners in Massachusetts to best serve the deafblind community. So I am the regional representative for New England. I work with Massachusetts mainly. I am housed in Deaf Inc. So I am neighbors to Elaine Ducharme and Jason Wells. I also work in other states in New England, including Rhode Island, New Hampshire, Vermont, Connecticut, and Maine. My role is to be a point of contact with the headquarters of the Helen Keller National Center in Long Island, New York. A little bit about myself. I am a former sign language interpreter. As well as an instructor at the Helen Keller National Center in New York, working on campus. As previously mentioned, Helen Keller National Center provides rehabilitation training, services, and supports. We have a residential center with dorms in New York, where we kind of have a one-stop shop for learning all of the essential skills to being independent in your community, including getting ready for employment, or just learning some new skills and tricks for any type of progressive vision and hearing loss. So HKC works with ages 14 and up. We have focus on transition age youth to help prepare for college, work, just being independent in the community, ages 14 to 22. We work with the New England Consortium for Deafblind as a partner as well, to help the transition age population move from school to working with VR agencies and adult services. Sometimes we kind of help facilitate that process. We also work with adults who are looking for employment, as well as senior citizens, ages 65 and over, or better, who might be looking to check out assistive technology, brush up on their independent living skills with age-related vision and hearing loss. We don't tend to have a strict rule about legal blindness or certain hearing loss decibel level, more so if it affects activities of daily living. In addition to progressive vision loss that later on could result in blindness or functional blindness, we do a lot of training ahead of time to help prepare, particularly around tactile strategies and specializations for deafblind. When it comes to accessibility, communication, technology and strategies that work best. So right now, our New York campus is closed due to COVID. However, we have moved over to a virtual environment. We have been creative and found some really great ways to work with individuals in their homes via online using assistive technology and sometimes the supports of SSPs or other natural supports in the home, such as a family member, to support and be able to continue this learning and growing despite the pandemic. We also have peer learning groups or support groups that we offer as well. You can check out our website at helenkeller.org. Peer learning groups, as well as contact me. I'm sure my contact information will be in the chat box. I will be here to answer any questions in the discussion. And you can also email me, send me a message, or call me on the video phone. I'm always available. We also are doing appointments in the Deaf Inc. office as well. So one thing that is very exciting and some news that I wanted to share with you all is that we have expanded. So right now, previously it has been just me in the Boston office. But now we have hired a deafblind specialist. Her name is Christine with a C, Telford, Telford, sign name CT on the chin. And I'm going to go ahead and let her introduce herself in a moment. I just wanted to applaud Doug Roland for his film and share that I know the actor, the deafblind actor, Robert. I used to know him at the center when I worked there. So just a really exciting time for seeing this film, getting nominated for the Oscars, and excited to be here and just work with all of you and partner with everyone on this call. So thank you so much. And I'm going to hand it over to Christine Telford. Thank you.
Okay. Hi, my name is Christine Telford, and my sign name is CT on the chin. I've been working with the deafblind community for over 10 years. I started off with my career starting working in group homes, but very quickly started working with employment services immediately afterwards. So for the past 10 years, I've been helping deafblind individuals find jobs. And it has been the best job ever. And I'm super happy to be here in Massachusetts. And I hope to help this community of wonderful people find employment and careers of their choice. So one thing I would like to precedent to everybody here is you can contact me or Tara, of course, anytime you want. But if you want to work with me with employment services, you have to go through MCB. So if you have an MCB counselor and you're interested in services, please contact them first. And then we can go ahead with the process after that. And it is a long process. I'm sure you all are aware of that. So just be patient and I'm sure I'll work with a lot of people. If you have any questions for me, feel free to email me, which is listed in the link.
Thank you, Tara and Christine. I know my department are very excited to now also have Christine available for additional vocational rehab services for the deafblind community across the state. So it's a wonderful, wonderful addition to the team, and we're super excited. And as always, we've had a great relationship with HKNC and the services that they provide. So thank you again, both of you, for presenting. I'm now going to introduce Kristen Lee. She is with the I Can Connect program. And I'll let her introduce herself and just explain the program and a little bit on how it works. Go ahead, Kristen.
Hello, everybody. I think I'm on. My name is Kristen Lee, and I work for the I Can Connect program at Perkins. I'm wearing a sweater with blue and purple spring flowers, and I have long curly hair. The name sign that was given to me by my consumers is letter K and the sign for curly hair. I think I said I've been in this position for 3 years. Jerry Barrier worked for I Can Connect before I came and took over that position. Brief note about my background is I was a teacher of the visually impaired. I taught at Perkins. I worked with blind children and deafblind children in the secondary program for many years. And I have also done assistive technology training for different rehab programs in other states. So I want to share some brief information about the I Can Connect program, and I will be around for the question time if anybody has specific questions about the program. I'll be glad to answer those. And if you have questions related to your specific services or eligibility, I invite you to contact me through email or by phone. I'm currently not working in my office, so if you call my office number, please leave a message so that I can call you back. So the I Can Connect program was created out of the federal law in 2010 it was called the 21st Century Communications and Video Accessibility Act. And the program is a nationwide program under the FCC. So there are programs in every state and US territory. The goal is to provide free equipment and training to all eligible deafblind individuals. It's intended to increase independence and reduce isolation. It enhances social interactions with friends, family, community, and anywhere in the world. So electronic distance communication is anything that can connect people across a greater distance. So any type of telephone equipment, computers, braille displays that can be used with computers, off-the-shelf devices like tablets, iPads can be provided. Now, the program does not cover hearing aids or face-to-face communication. The website to get information about contacting any of the state programs or to look at some of the equipment is www.icanconnect.org. And there is a combo box where you can choose the state, and that you can also find our contact information under there. And applications are available to be downloaded, or you can call or email and request that we send out an application. We have them available in regular print, large print, English, Spanish, and Portuguese. And there is also a hard copy Braille version, which I believe is only available in English at this point, that can be sent out as reference. The eligibility requirements are that you meet the definition of being deafblind with the combined effect of both vision and hearing loss that causes significant barriers to living independently. And there is an income eligibility requirement, which is similar to the requirement for other low-income federal programs. It's 400, like 4 times the federal poverty limit, and that gets adjusted every year in January. The new amounts come out, and so it's based on that number and the number of people in the household. And there's a table that lists those current values that's part of the application packet. So each year we update that. This is the 9th year of the I Can Connect program. It started in 2012 with a 5-year pilot program. And so once an applicant is accepted into the program, they receive an individualized assessment to help determine what equipment and training they will need to meet their distance communication goals. And then the program covers setting up the equipment, providing the training, and any repair or replacement of that equipment. The program cannot cover training on equipment that was not provided by the program. So if somebody purchased their own iPad, I Can Connect would not be able to provide training on that device. Consumers can receive additional services from the program. We try to follow up with any consumers that we haven't worked with in more than a year. So every year we go through our consumers in the database and we email just to follow up if we haven't heard from you in more than a year. So most of you would receive an email. If the email comes back to us, we will send out a letter to the mailing address that we have on file. So we do try to check in and ask if your equipment's still meeting your needs or if you need additional services. So if there's anybody out there that hasn't heard from us and would like to, it might be possible that we don't have your current contact information. So please reach out to us if you're in need of additional services. We do not require that people resubmit the whole application. The same thing is true if somebody moved from another state and was in the I Can Connect program in another state and they moved to Massachusetts. There's a way to transfer services between states as needed. So I think that's all I have for an overview, and I welcome your questions later. Go ahead.
Thank you, Kristen. Thanks so much for that information. And yes, please, if anyone has questions about any of the programs and the representatives that were presented so far, please feel free to put them in the chat. We are collecting them all and we'll be addressing them at the end of the presentations. So I'm now going to turn it over to Lisa Chiango. She will be presenting about the Deafblind Coalition and information about that program. Lisa, are you there? There she is.
Hi, everyone. Good morning. The deaf community, deafblind community, and friends who are here today. I'm going to talk to you about the Deafblind Coalition. The goals of the Deafblind Coalition are to build awareness about the needs of deafblind individuals from birth to senior citizens who live in Massachusetts. Every year, the community of deafblind people go to the State House for Deafblind Awareness Day. This year, because of COVID, we were not able to go there in person. But the purpose of Deafblind Awareness Day is to increase awareness about concerns and issues within the deafblind community. And programs that could support our mission. I'll name some programs that we work with.
State House Legislative
We have Carl Richardson, who coordinates services for access within the State House. And I want to recognize his efforts over the many years the Deafblind Coalition has been hosting Deafblind Awareness Day. If people want to meet their legislators at the State House, the coalition encourages you to discuss your concerns and issues about programs that are happening in the community or lacks of community. Excuse me, lack of services within the community where you live. The kinds of personal stories and personal experiences you share with independent living centers or Mass Commission for the Blind are essential for our legislators to hear directly from you. There are many programs that need funding and need support from the legislators. We have other organizations that are part of our coalition. Dbes, New England Coalition for the Deafblind, Consortium, excuse me. DBCC, Deafblind Contact Center. The Helen Keller National Center. We have the regional office here in New England. The Massachusetts citizens who are deafblind. Perkins School for the Blind.
Local community members are also part of the coalition.
And local community members are also part of our coalition.
All of the members of the coalition.
I want to thank all the members for our help, for the help, and for your participation. Thank you so much.
Thank you again, Lisa. This is Leslie again. Thank you so much for that information. And as you'll see, a lot of the programs and the presentations that you've been hearing today, everybody's kind of intertwined. So the deaf community, the deafblind community is a small community. So everybody's kind of related and programs and services work together, which is a wonderful thing. And I'm now actually leads me into our next presenter. Oh, I'm sorry. I think we need a interpreter switch.
Yes, that's correct. Just give us a couple of minutes. That's okay. Perfect. Thank you.
Okay, I'm going to introduce Tracy Evans Lewiselli, Talia Mango, and Lily McDonough, who are presenting about the New England Consortium on Deafblindness. And I think, Tracy, you're going to be speaking first? Okay, thank you. Go ahead.
Hi, everyone. My name is Tracy Evans Lewiselli. I'm director of the New England Consortium on Deafblindness. I'm wearing a black shirt and a blue scarf. My sign name is the letter T to my right eye, and our educational consultants, Talia and Lily, will introduce themselves shortly. First, we want to thank MCB for inviting us to speak with you today on this beautiful spring day. The New England Consortium on Deafblindness represents a federal grant funded by the Office of Special Education Programs and serving the states of Connecticut, Maine, Massachusetts, New Hampshire, and Vermont. Our regional office is located at Perkins School for the Blind, representing a long-standing history of support from Perkins for our federal deafblind grant and the children and families we serve across the 5 states. Our federal mandate from the Office of Special Education Programs is focused on 2 major areas. First, to identify infants and children birth to age 21 with combined vision and hearing loss through a range of collaborative agreements and partnerships. We are charged with submitting child count data to the National Center on Deafblindness, known as NCDB, on an annual basis. Secondly, our mandate is to support educational programs for children who are deafblind or at risk through consultation and training to educational teams. And now, due to COVID, all of our services are provided virtually. Our key partners, to name just a few, include MCB, of course, MCDHH, DDS, Perkins Programs, HKNC, members of the Massachusetts Deafblind Coalition, the National Center on Deafblindness, and of course, a variety of providers from early intervention, early childhood programs, private public educational programs, voc rehab, and medical care providers. And with that, now Talia, take it away.
Hello, this is Talia. I'm an education consultant for NEC. I'm wearing a black sweater and I have a gray background. Now I'm just going to talk a little bit about the eligibility for NEC. NEC does not require a specific acuity measure or specific decibel loss for a child to be eligible for our services. Based on IDEA, if the team determines that hearing and vision are affecting learning, a child would be eligible for services with NEC. We work from an educational perspective rather than from a rehabilitation perspective. Every year we collect data, and that data is submitted to the National Center on Deafblindness. The data is broken out into children aged birth to 3, preschool age, school age, and transition age. Out of our 5 states, Massachusetts has the most children identified, and half of the population in Massachusetts is transition aged, which matches with most of the states across the country. And that is likely because a lot of the time referrals increase as a student gets older because the school may be seeking help. And now I'm going to pass it off to Lily, who's going to talk more about our program.
Hi, everyone. This is Lily speaking. I am also an educational consultant at NEC. My sign name is the letter L to the left and then right cheek. I am wearing a black shirt and I am sitting in front of a light gray background. So I am going to briefly go over the different levels or tiers of services that we provide at NEC for students and teams. Tier 1 involves sharing information and resources on deafblindness through our website, social media, newsletter, and blog. We update our newsletter monthly with different topics related to deafblindness and share information about our relevant upcoming events. Tier 2 is short-term, so it involves targeted consultation and training where we help teams identify specific content areas that the team would benefit from. And we provide workshops, trainings, and conferences for parents, families, and professionals. This also includes family networking events, resources, and supports. Tier 3 is more in-depth. It involves intensive consultation and trainings to teams. This type of intensive consultation is ongoing and focuses on sharing evidence-based practices with educational teams. In terms of the events that we host at NEC, we provide a variety of events and services to the families and educational teams of registered students. We have our ongoing consultation and training around home-based routines. We host trainings and professional development modules like our NEC Winter Summit. For families, we have monthly connection calls where families can listen to a discussion about different topics. For example, we recently held a family connections call that covered accessible summer camps. We have in-person events such as Family Bike Day, Family Weekend, and apple picking. All of our events are at no cost to the families. We will be hosting an outdoor COVID-safe event for families this upcoming summer. So thank you for giving us the time today to share our resources with you. We are hoping that sharing more information about NEC will lead to the referral of children and families who you feel would benefit from NEC resources, and that our information today will be shared with other related professionals. If you have any questions about possible referrals, feel free to reach out to us. Our contact information is on our website, nec4db.org, which we will add to the chat. Thank you very much.
Thank you, Lily, Talia, and Tracy. I appreciate you presenting about NEC and all the great work you guys are doing. It's really fantastic. I'm now going to introduce Nasra Nicola. She's from the Department of Public Health. And she'll be talking to us about some COVID-19 vaccine updates and other related information for the deafblind community. Go ahead, Nasra.
Hi, my name is Nasra Nicola. For those of you who don't know me, I'm a fat, light-skinned Arab American with dark hair, big sort of cat eye glasses. And if you see me in person, I would probably be in a power wheelchair. But today I'm just sitting at home at my desk. I am the coordinator for the Health and Disability Program at the Department of Public Health in the Office of Health Equity. And basically our role within the department is to make sure that every program run by the Department of Public Health equally benefits people with all types of disabilities, and that people with disabilities, including deaf and deafblind people, have equal access to all of the things that they need to be healthy. Right now, that means COVID vaccines. So as you're probably aware, it is still pretty hard to get a vaccine right now in Massachusetts. There are a lot of people waiting in line for vaccines or waiting for vaccine appointments. And
thank you, Holy Mother Mary.
Not a lot of shots available. But the state has opened up a pre-registration website that allows you to list your name and your contact information. And then instead of you having to check every day to see if there's an appointment available, someone will contact you back and let you know when there's an appointment available, particularly at one of the large mass vaccination sites. And Carla just pasted in the chat the website for all of the information about the COVID-19 vaccine in Massachusetts. I am happy to answer questions about the safety of the vaccine or concerns about getting the vaccine. I'm also always eager to take concerns about accessibility. Feel free to email me. Carla just put my email address in chat too. For example, when the website had problems with screen reader accessibility, many members of the community let me know about it, and we were able to get it fixed so that people could get more information about the COVID vaccine on their own. We've also made the 211 hotline available to deaf and deafblind people calling in via relay who may not be able to access the website to make appointments themselves and may want someone to help them enter that information in for them. But we are always looking for more information about how we can do better. There is a question about in-home vaccination that is available to some people, particularly Mass Health members. If you are on Mass Health, I encourage you to contact your insurance care manager who would be the one organizing that. Again, that goes through the care plan rather than through DPH. Thank you for asking that, BJ. I want to be careful not to take up too much time on the agenda since it looks like we are already running a little bit late, but I am here for questions and yeah, willing to talk to you about anything vaccine related, anything public health related today and via email forever. It's a standing offer. So thank you very much for having me, and I look forward to talking to you continually.
Thank you again, Nasra. We appreciate you being here and sharing your expert information on the vaccine. It seems to change constantly, so I'm glad you were able to join us and give the most recent information. Carla, would you like to introduce our next segment?
Absolutely, Leslie. Thank you so much for everyone providing their information with us today. We have collected all of the contact information from our presenters, including email addresses and websites, and we will be sharing that at the end of this meeting today, but we will also share it after and share all the materials that have been presented with you as well. So without further ado, I would like to introduce Director Doug Roland from the film Feeling Through again for the second clip today. I believe that Doug is still with us, although I do know that he is still on the lot there in California. So Doug, are you with us?
I am here. Thank you so much, Carla.
Okay, I will let you take it and go from here.
Great. Well, hello, everyone again. Doug Roland back here, white male in my mid-30s. I've got round glasses on, short dark hair, a green button-up shirt, and a plain white background. And earlier we looked at a clip from my film Feeling Through. That was, we discussed was the an example of an encounter between a sighted and hearing man and a deaf-blind man. And we talked about how the awkwardness of this first meeting. This character, Tariq, who's never met anyone who's deaf-blind and doesn't know how to interact and is a bit uncomfortable and awkward about it. But that's going to lead to this second clip that I believe Carla has the ability to queue up here that we'll watch, and then I'll share a couple words about that. Is that something we can cut to?
All right. All right, Doug, I am going to begin sharing my screen now. Okay.
So now they're on the city bus. The deaf blind person is getting ready for his route, and the sighted hearing person is writing in his hand, "You will be okay," and the two hug. You can see the hearing sighted person a little choked up with emotion. His eyes are tearing up. The deaf blind person touches his shoulder and then sits down. The hearing sighted person looks at the other people on the bus, thinking about the experience of being on the bus alone, and then he leaves the bus. You see the deaf blind person sitting quietly. His facial expression is one of peace.
Okay.
All right.
Thanks for showing that clip. And, you know, as you can see in that clip, it's a very different story from what we saw in the first clip. Now these two characters have formed a really meaningful relationship with each other, are sharing a heartfelt moment, and Artie, our deafblind character, is giving Tariq words of support to help Tariq in his journey moving forward. And you know, again, I wanted to show this second clip because it also mirrors a lot of what we've seen in sharing this film with audiences around the country and around the world, in, you know, engaging in a lot of conversations with Robert, our deafblind actor, as well as a number of other people from the deafblind community who have been a part of a number of our accessible panel discussions at the conclusion of our screenings. I'm going to hold for a second. I think we just lost our interpreter. Are we, do we have an interpreter coming back up?
Yes, hold on 1 second, please.
We're just gonna have Beth Lucy spotlight, please.
Thank you.
Okay, here we are. Great, so we'll continue here. Yeah, something that it's this kind of transformation from this first moment that we saw to the second moment is emblematic of what we've seen with audiences across the country, which is once there is a entry point to touch people's hearts and get their minds thinking in a different way, there's a real deep earnest curiosity and desire to connect with the deafblind community, and we've seen it many, many times over. And it's something that's been a beautiful part of this experience and very encouraging. You know, we're fortunate in this case to use the power of storytelling to help foster these new perceptions. But I know so many of you on this Zoom and a lot of people who've shared their work and their journeys today do it through other modes. So, you know, all of these modes add up to create a whole that I think leads to a lot of really positive change in perceptions and connections. And I'd like to just close too by saying that, you know, ultimately what we are doing with this story, and that you kind of also see at the end, as opposed to what we saw initially, you know, when some people see the scene initially of Tariq trying to interact with Artie, there's this assumption that it's going to be a story about a sighted and hearing person helping a deafblind person. And, you know, quotation marks around that this trope of someone who's non-disabled helping someone who's disabled. But what we learn, as we see in this last scene, is that it's just as much, if not more, of Artie, who's the deafblind character, helping Tariq, who's the sighted and hearing character. And I think the lesson in there is also very much a reflection of what my experience has been, as far as how much mutuality there is to be had between, you know, communities, in this case, you know, the sighted and hearing community and the deafblind community. And when these connections are forged, there's such a beautiful mutuality and trading of gifts that can be given. And that's something that I've experienced greatly over the last few years. So I'd just like to close by thanking MCB for having me today, thanking Tara for her very kind words earlier, and the beautiful partnership I've had with the Helen Keller National Center and Helen Keller Services throughout the process of creating and exhibiting this film. And lastly, as was noted, we are currently nominated for an Oscar. And this is a beautiful opportunity for us to continue to share, to have a greater spotlight on the film as we share it with more people and spread it outward. So for anyone who hasn't seen the film, or if you have and want to see it again, you can go to feelingthrough.com, and there you can find not only Feeling Through, but also the behind the scenes documentary that kind of tells you the whole story behind the story. And if it's something that you are compelled by, I'd hope that you'd share it far and wide, because the greatest asset that we have is the community that we've connected with throughout the last 3 years, the ability to connect and share this message and work together to ripple it out. So if that's something that you're compelled to do after seeing it, that would be wonderful. Thank you so much. It's really been an honor to speak with you all today. And I hope to connect with you all again some other time.
Right. Thank you so much to Doug and his team, and to Helen Keller National Center and Helen Keller Services for all that they are doing to amplify awareness about the deafblind community. And Doug, I know that the commissioner was writing in the chat, Commissioner D'Arcangelo, that he is cheering for you, and we are all cheering for you in anticipation of a really great announcement on Oscar night for Feeling Through. We're confident in all that you have done, and we are very grateful. So we are going to take a few minutes here for a break, but I did want to ask again, if you have questions, to please put them in the chat during this time, and we will collect all those questions, get them to our presenters who are still with us, and get you some answers and some resources, and answer as many questions as we can. And we will come back. This break will last about 5 minutes. We'll come back here right after 12:15, a little closer to 12:20. And we'll have until 1 o'clock for questions, answers, discussion. Thank you again for joining us. We'll take a quick break for 5 minutes and come back here for questions. We'll start at 12:20. Hi, everyone, and welcome back from break. This is Carla Cath, Communications Director for MCB. And thank you again for joining our town hall for the deafblind community today. We have collected all of your great questions via the chat during presentations, and we will continue to collect those questions and get to as many as possible now. And I would like to introduce my MCB colleague from our Deafblind Extended Supports Unit. Her name is Stephanie Matuccio. Stephanie will be addressing those questions to all of our presenters. So we ask that our presenters please be on standby to turn your videos on and off during the time that you are speaking. And we will have you on video with our CDI during that time to provide answers to any questions. All right, thank you.
Forgot to unmute, excuse me. My name is Stephanie Matuccio, and I am the Deafblind Extended Supports Case Manager for the Northeast region. And I am just going to go through some of the questions that we have received, either before today's town hall or during. The first question goes to Doug Roland. So I will ask the question and then ask Doug if you are still here to pop on and answer the question. It is, what experience in your life gave you the motivation to go on a journey to learn about the deafblind community in developing and pre-production phases for Feeling Through? What was your most memorable experience producing the film? And it looks like Doug is no longer actually on that call. He may have answered some of those questions, but we can certainly look to have those sent to him. So we will then move on to another presenter. Nasra, I know you were answering some questions in the chat, but I feel like it is super important for those responses to be said to everyone aloud. So there have been a few questions for you. One is there any work to be done to make the COVID-19 vaccination rollout more accessible for those who are deafblind? Most vaccination appointments do not allow much notice to request an interpreter or to secure a provider. And then in conjunction with that were the questions you fielded in the chat, which were around DPH, MCDHH having on-site interpretation and how to coordinate. So I'm going to turn it over to you.
And just, yeah, let me know when I have permission to start my video.
Go ahead and start your video.
It's, yeah, no, it says the host has stopped it.
Oh, I'm sorry.
There we go. Okay. So yeah, so those questions are kind of related. What can be done to improve accessibility for deaf and deafblind people, and what's the deal with on-site interpreting? So I'll kind of answer them together. First is it's an ongoing process. There is a work group that has members from MCB, MCDHH, DPH, the COVID Command Center, and sometimes members of the Mass Office on Disability. And we all get together occasionally to push this forward and consistently improve the accessibility of sites. One of the big problems that we know about is the availability of interpreting. And just kind of to describe what the problem is, a vaccine appointment takes About half an hour, start to finish. That's when you get there, you fill out the paperwork, you get your injection, and then you wait for 15 minutes to make sure that you're not having any kind of reaction. That whole process is about half an hour. To schedule an interpreter for that time is a 2-hour minimum. And it means that that interpreter will be there for an hour and a half, not only not doing anything, but not being able to serve anyone else in the state who needs an interpreter at that time. So we're trying, knowing that interpreters are a valuable and scarce resource, we're trying to figure out a good way of using their time appropriately. We did try at one point having interpreters present all day at Gillette and Fenway for a weekend. And the problem with that was having them all day took away even more time. And it turned out there were no deaf people with appointments booked that day. So it benefited nobody. So that's the challenge we're working with. And I say that not to ask for pity or sympathy, but to demonstrate that we're really actually thinking hard about it, and that it is more complicated than it sounds. We would like to eventually have some designated days where we know that a bunch of deaf or deafblind people have signed up to have vaccines on that day, and then make sure to have interpreters, SSPs, anyone else who's necessary for access, all available to serve a bunch of people at a time. We have not gotten that coordinated yet. And that's not a great answer. Like, that's not something I enjoy having to say. We're not there yet. We know it's a problem. In the meantime, when you do make your appointment, make sure, particularly if you make it through 211, indicate at that time that you need to book an interpreter, and hope that there's someone available with that kind of notice. Again, I don't like to use the word hope in connection with any kind of state-run program. It should not run on hope. But that's where we are at this point. We're working on it. And right now, we need your help and patience.
Okay.
Yeah.
Thank you very much,
That's what I got.
Nope. It is may not be the answer that we want, but is the answer that we have at this point, but you're working on it. So
Yeah.
Thank you.
And like, at least I'm not going to pretend that it's better than it is.
Okay. So then we have another question. This question is related to HKNC. So Tara, if you could join us. The question reads, how do you provide deafblind IL services in other regions? Do you have a contract with other IL centers? Do you provide SSP in other regions other than Deaf Inc.?
Hello again, this is Tara speaking. Quickly wanted to give a quick visual description of myself to start. I have long, wavy blonde hair. I am a white female in my 30s, wearing a black shirt with a white background or light background. And I have dark glasses on. And I also have these earrings that look like little canes, since I'm a mobility instructor, since I teach cane travel. So BJ Wood It's a great question. So thank you. I'm glad we brought it to discussion. I wanted to answer you in the chat, but I wanted to also bring your question to everyone so we could all benefit from the answer. So HKNC partners with voc rehab agencies like MCB. So to receive training services specialized in deafblindness through HKNC, you need to have an open case with MCB, Mass Commission for the Blind. In other states, it's very similar. We work with other vocational rehabilitation agencies. We partner with them, and we can provide training. In orientation mobility, for example. So mobility, assistive technology, communication such as Braille or tactile ASL, including haptics, independent living, and low vision audiology. Right now, we're mostly functioning online through virtual platforms. We've done a lot with Zoom, video phone, any way to access in an online environment. So we can work with anyone in their home if they have an internet connection. We've also been able to have people meet us at Deaf Inc. if they don't have an internet connection to be able to do some type of trainings or assessments as well. So we offer a variety of training options for people in different regions and states. To clarify on the SSP question, HKNC does not provide SSP services. We simply refer, in this case, to DBCAN, which is state specific. So in another state, for example, New Hampshire, I would refer to their state SSP program, and I could help with the application process, explain what an SSP is, and kind of be that point of connection between. So part of my role is to be aware of all of the local, state, and national resources and programs, and to be able to facilitate that connection between the deafblind community and these services in their state. And the Helen Keller National Center itself works across the nation, you know, including Alaska, Hawaii, Virgin Islands, Puerto Rico, Guam. We are very far reaching. So we do our best to also help and advocate for some states or areas that don't have SSP programs, but that's the extent of our involvement in providing SSP services. I hope that helps answer your question, and thank you so much, BJ. You've had great questions throughout.
Okay, this is Stephanie. Thank you very much, Tara.
Mm-hmm.
So we are going to move over to another series of questions. These are directed towards the Director of the Deafblind Services, Leslie Baker Johnson. And these are a cluster of questions that go together and then a few others. So we'll do the ones that go together first, and then I'll ask so we can all keep track. The first series is, what age does the DBES unit begin working with people? Does MCB register folks who are diagnosed with a progressive condition in advance of meeting the definition of legal blindness? Leslie?
Hi, this is Leslie. Stephanie, would you mind please just reading that for me one more time? I was having a little technical difficulties.
This is Stephanie. Sure. So the first question is, what age does the DBES unit begin working with people? And does MCB register folks who are diagnosed with a progressive condition in advance of meeting the definition of legal blindness?
Well, I will address the age question first. MCB as an agency it serves clients who are legally blind from birth to death. We have a children's services department within each region that provides services to children from birth to age 14. At the time they turn 14, if they have DDS involved with their services, or if they are deafblind, they get referred to the DBES unit at 14. However, most cases between 14 and 22, or depending on when the student leaves high school, leaves the school district, the majority of their services and supports are provided through the school district. There isn't a lot of services that we provide because we are an adult agency. So most of our funding is allocated to individuals once they turn 22, because they no longer have the support and the funding through the school district. But we are available to families for advocacy, various other needs that they might have, anything that might not be covered under the school district. Sometimes summer camps, we're able to provide some financial assistance for recreational activities for kids between 14 and 22. But it is a case-by-case basis. Sometimes it depends on the funding we have available and what programs are out there. And I know we need to switch our interpreters. Do you want me to switch before I will go on to the second half of the question?
We'll go ahead and switch the interpreters now.
All right. So the second half of your question, people with progressive vision loss. And yes, we do. But when you're not legally blind, the services are limited to vocational rehab services. So for students or adults who have a progressive vision loss, I believe it does need to be at least 20/70. And the doctor still needs to send in documentation and stating that it's a progressive vision loss. And then we're able to provide services for vocational programming. Any of our state funded or social rehab services would not be able to be provided until the vision gets to the point of 2200, 20/200, which is the definition of legal blindness in Massachusetts. But if it is a student between 14 and 22, and they may have ushers or another progressive eye condition with a hearing loss, we can provide pre-ET services, which are specific pre-employment training that we do for our youth in the community to prepare them for employment after school, after high school.
Okay, this is Stephanie. So another question directed towards you, Leslie, is how do I know if I am getting all of the services I am eligible for?
This is Leslie. I feel like I should just leave my video on. So the best way to know you're getting all the services is to make sure that you're communicating with the case manager, whoever your case manager is. Your case manager's role is to make sure that you are getting all the services that are available to you, that are appropriate and that meet your needs. And so the communication between you and your case manager is going to be extremely important. So as long as you are keeping in contact with them and expressing what your needs are, then the counselor will make sure that you're getting what you need.
This is Stephanie, and the last one in the series for you, Leslie. What challenges has COVID-19 caused for the typical services you provide? Are there any ways hearing or sighted people can help?
Thank you. Well, COVID-19 has been a big challenge, specifically for our consumers and our staff. I think MCB as a whole has done a tremendous job in converting to remote services. However, you can imagine how difficult that is for some of our deafblind consumers who don't have access to in-person interpreters, and we're not able to meet with them in person either. So it's been a bit of a struggle. A lot of programs have been shut down, also limited in-person programming as well. But then we've been lucky enough to have agencies and programs like HKNC and DBCAN and Deaf Inc. and everyone else that we work with who have gotten really creative with providing remote training, remote services. And as people are getting vaccinated and as the state is opening back up, we're hoping that things will get even more back to normal and that these programs and services can resume. And especially for our deafblind individuals who are needing that in-person contact for interpreting, as well as sighted guide and SSP from DBCAN, is going to make a big difference. I know a lot of people are waiting for that vaccination status to come in. Many of our day programs for a lot of our deafblind DDS clients who were attending day programs were no longer able to attend day program. And so they've been stuck in their group homes or in their family homes and not able to participate with their friends and get that community access that they had before. So we're really looking forward to things getting better.
This is Stephanie. Thank you, Leslie. The next few questions are going to be directed to Carla Kath, the Director of Communications here at the Massachusetts Commission for the Blind. Carla, the questions are, how do we get a copy of all the contacts and emails? And I'm assuming it's all of those pieces that have been placed into the chat during the course of our town hall. And then also, how are MCB participants alerted to meetings concerning issues pertaining to the deafblind services?
Hi, this is Carla Kath from MCB. Thank you, Stephanie, and thank you everyone for your questions today. We do have all of the presenter information, which includes email addresses and websites available for all participants today, and we will be sending that out following the meeting via email. And if you do not receive a copy of that information and would like it, please send an email to deafblind@mass.gov. And we will share that with you. We have also recorded the meeting here today, and any other information that we are able to share, we will get to the participants via email. If you would like to participate in future events with us at MCB, you can find that event information on our website at www.mass.gov/MCB. And you can also find on that same website an online form to opt in for emails that share our upcoming event information, leadership messages, more recently, COVID-19 information, and more. And you can also reach out to us via our 1-800 number. That number is 1-800-392-6450. Now